So it's breaking at that lower cervical right there. Snapping up mid to lower dorsal. And there's a snap right down here at that L5, S1. That right there is it's the sacrum right there. And this is a really unique case here because there's a pretty significant spondy. Now, just so you know, these are relatively common. Maybe 5, maybe 10% of the population. Either people are born with them and this is broke. The other option is people have is they were wrestlers or gymnasts. Those are another very common thing, and generally it happens when somebody's falling on the floor and their legs are kicking over ahead of them, and it snaps this vertebrae off here. It breaks at the pars, and the vertebrae just kind of shift forward. Rarely ever does it ever become a surgical condition. As a matter of fact, yours was the only case I've ever heard that somebody would consider that. That doesn't mean some people don't even know they have them, and some are very asymptomatic. When we examine this, for us, we just know that we need to, since that's where the IVF is, that's where the nerve is coming out, we just have to set that a little bit. Now that'll never come back to perfectly in alignment, but even a little bit of pressure off that gives you a tremendous amount of change in your comfort level, and certainly in your lifestyle then too. We can get back into doing your fun stuff. So, all right, let's get this corrected here. Extremely important here is to make sure that you're on the right segment here. You do not want to be high on these. That's why we use the X-ray too. Breathe up. Just nice and gentle, very, very light push. Mm-hmm. Okay, come on over here. Breathe up. And in the neck, once again, we talk about this in a lot of our other videos, your problem is right here at C7, and when that shifts down and back, the vertebrae on top of it have to compensate, and that's how you start to lose that curvature in the neck. Mm-hmm. It's not poor posture, that has nothing to do with it, it's that subluxation. Be nice and gentle. So that's completely to the other side, coming back towards center. You came in, you've been here maybe 4 or 5 times?
Around there.
Around there. Obviously the low back was something that was big, really big in the neck. You said your big issue at the time was your sleeping. How's your sleeping been? You said at that time you were alternating back and front. Has your sleeping changed at all?
Yes, sleep is a lot better. I can fall asleep on my back now without any pain.
Okay. I know you want to get back into doing your running and your cycling. You might have even started cycling already. But I know a concern for you when you came in was I think you said you had 2 months and you had a surgery for the spondy setup. Is that correct?
I have an appointment tomorrow to talk about whether the surgery was approved for my insurance, and then talk about dates. Yeah.
What are your plans?
For right now, I just want to hold off and go through the treatment here with you, and go through the entire room and see how I feel at the end of it, and see if I can manage pain, and then continue doing things like grappling and running.
Okay, all right.
Even if I have to give up running, I'm okay with that.
Okay, all right, yeah. But the grappling probably be better off in the cycling, certainly. Yeah, because what they do on these surgeries here is what they'll do is they'll stabilize it, but they'll either put a screw in on the front or the back, but they stabilize it, but it's still stabilized in that position. Mm-hmm. So that's why it's much more logical. Let's just correct that first. Mm-hmm. So you're getting better. Yeah. Thanks, buddy. Thank you.
Thank you, Doc. Appreciate
All right,
it.
man. Thank you.